Okay, so yes, I'm Amy, I'm one of the paediatric registrars, and we've done an audit looking at compliance with valproate prescribing. So the background to the audit is that valproate is now under strict regulation due to its association with significant risks of birth defects and developmental disorders. Data suggests that if children are exposed to valproate in utero, they're at a 10% risk of a birth defect and between 30 and 40% risk of developmental disorders, which includes delayed speech, delayed walking, and they're also at increased risk of autism, and there's studies to suggest that ADHD is also occurring. The reason why it's so important and the focus is on valproate is the risk of harm to unborn babies is higher with valproate than with other epileptic or bipolar medications. And these risks are present even at smaller doses of valproate. So in March 2018, the Medicines and Healthcare Products Regulatory Agency released guidelines which have included periodic updates that require action by all involved in the recommendation, prescription and dispensing of valproate. So this is aimed at specialists, GPs, pharmacists, midwives, emergency department doctors, specialist nurses, and obstetricians as well. The MHRA regulations state that valproate must no longer be prescribed to women or children of childbearing potential unless they are on the pregnancy prevention program, which is also known as PREVENT. They have said that childbearing potential is any female that is premenopausal, so it covers a huge range. So in the 29th of March 2019, a guidance document on valproate use in women and girls of childbearing years was released, which has been a really helpful guide. It's been endorsed by 17 national bodies, including the BPNA and the RCPCH. Its purpose was to provide practical information, guidance, sources of further support to clinicians managing female patients on valproate, and it recognises that in daily practice, challenging situations may arise when valproate is being considered, reviewed or discontinued. So I'll quickly whiz through this, that this is from the 2018 guidelines, but the pregnancy prevention programme requires specialists to assess the patient's potential for becoming pregnant, explain the known risks to the unborn child exposed to valproate, conduct a serum pregnancy test before and during treatment as assessed appropriately, and explain the need for highly effective contraception and arrange for this. And they have defined highly effective contraception as an independent method, so an intrauterine device. And if they're not using one of those, then they've recommended 2 other forms of complementary contraception. And they need to complete an annual risk acknowledgement form to confirm the provision of this and send a copy to the patient and one to the GP. They also need to be seeing the patient urgently within days in a case of an unplanned pregnancy, or if the female wishes to plan a pregnancy, provide a patient guide, and only continue treatment or start treatment with valproate if other treatments are ineffective or not tolerated, and pregnancy is excluded by means of a negative pregnancy test. There's also actions for general practitioners, which is similar to the specialists, but they are being asked to identify all females of childbearing potential on valproate to refer them to specialist services. And once they've been seen by specialists, the GPs are expected to review her and ensure that she is on PPP contraception, and she's got a patient guide, a signed copy of the ARAF, and that she is using her contraception appropriately. So the aims of our audit were to identify all the female patients under the care of a paediatrician at Peterborough City Hospital who are taking valproate, and to audit these patients to identify if we were meeting the agreed standards detailed by the MHRA PPP guidelines. So Peterborough is a relatively large district general hospital. It's on the northwestern border of the East of England deanery, and Peterborough has a population of just under 200,000, and we estimate that we treat about 350 young people and children aged 0 to 19 with epilepsy. So the audit standards, we looked at whether patients on valproate had a signed ARAF form, whether GPs and pharmacists had alerted us that young people were on valproate, and whether the specialist had reviewed the need to continue valproate. We looked to see if the patient or parent or caregiver had received the patient guide, and if we were meeting the standards of PPP if the patient was of childbearing potential. So it was a retrospective study. We used clinic letters and Evolve and eTrack, which is our electronic systems in the hospital. We identified the patients by searching through the epilepsy and neurology clinic lists and by emailing consultants. We collated the information on a proforma, and we audited against the agreed standards. We registered this audit in November 2018, and we presented it at a local meeting in February 2019. And we identified patients under the care of 4 different paediatric consultants. So we identified 163 female patients being treated in neurology and epilepsy clinics. Of these, 12 were on valproate. Of the 12, 5 had a signed ARF form, 7 didn't. So one GP had alerted us about a female patient, and 1 community pharmacist had also. Of the 12 patients on valproate, there was no documentation regarding the use of contraception. The mean age of our patients identified was 10.5 years old. 2 of the patients were 16 years old, and the age range was from 4 years 3 months to 16 years 11 months. So at the time of the audit, 2 of the 12 patients without an ARAF were in the process of being weaned off valproate following the MHRA guidelines, and following the presentation of our audit, a further 2 patients have also been weaned off. So the recommendations from the audit is we contacted the consultants managing the female patients without an ARAF and alerted them and made sure these patients had a clinic appointment coming up. As I've just mentioned, 4 patients of the 12 are being weaned off valproate following the presentation. We recommended that there was improved documentation on PPP-approved contraception, as the MHRA guidelines state all women of childbearing potential should not be prescribed valproate unless they're on the pregnancy prevention programme. However, we did present this audit in February 2019, and the guidance document on valproate use in women and girls of childbearing years was released in March, which provides a really useful clinical framework for managing these patients, as sometimes it's very difficult to know exactly whether or not it's the right thing to be starting them on contraception. The guidelines splits it up, so it considers children aged 10 years and under, between 12 or 10 to 13 years, and 13 to 15 years. And it's really key that it's got a lot of useful information, but the key point is that the patient is the centre of the decision-making process, and that's clear documentation. So the limitations of our audit is that we may not have captured all the female paediatric patients, as we just used the neurology and epilepsy clinic lists and relied on responses from the other consultants. So there may be patients treated in different clinics, and also there may be patients treated with valproate who are not under the care of a paediatrician at Peterborough City Hospital within Peterborough area. The other thing we need to consider for the future is we don't have an operational database at present, so we may have missed any new epilepsy diagnosis or new patients starting valproate since the audit. And we haven't made any links with CAMH or psychiatry, as valproate is also used to treat bipolar disorder. So future initiatives is we want to share our audit at a regional level via EPIN, and at a national level, and today is a good time to do that. And the MHRA are currently leading discussions on the creation of a registry of women and girls of childbearing age who are taking valproate, and they're very keen to keep a record of any patients that have been switched from valproate following the release of their 2018 guidelines. So we've got that information up until February 19. So I just wanted to thank the audit team and the patients and the families of epilepsy, and Sharon, our wonderful epilepsy nurse, who did a huge amount of work on this with me. Okay. And then I had some feedback from my nephew when I presented it to him yesterday, who said it was all right, but it was I only understood a few words like and or, and it didn't have very many pictures. So I put a lovely picture of my children to distract you all from asking any difficult questions.